Hi, my name is Hannah and I'm a pharmacist. Today we're going to talk about how to use a FlexTouch insulin pen. What you'll need today is your FlexTouch insulin pen, a pen needle, and a few alcohol swabs. I'll show you a few things on the insulin pen before we get started. The first is the dose window, which we'll talk about in a couple minutes, along with the dial to dial your dose. And then we'll talk about the button on the end later as well. When you take off this pen cap, you can see the insulin on the inside of the insulin pen. The insulins can either be clear and colorless or they can be cloudy, so ask your pharmacist which one yours should be, and then check to make sure that your insulin looks the same every time before you use it. If your insulin is a cloudy type, you'll want to roll the pen in your hands until it becomes uniform before each and every dose. So before we start injecting our insulin, we'll want to wash our hands with warm soapy water. And then get your insulin pen, open it up, and swipe the top with your alcohol swab. Then you will open up this pen needle, and the first thing you'll see is a needle on the end of it, and that goes into the insulin pen. So you put the pen right down on the insulin needle, and then twist and turn until you feel a little bit of resistance. Once you feel that little bit of resistance, you can take off this outer cap, and we're going to save this to take off the needle again in a couple minutes. And then this inner cap, you can take right off and throw that away because we won't need it again. Before each and every time you inject, what we first want to do is what's called a priming dose. So we use the dial and we twist up until we get to 2 units of insulin. And kind of like I showed a little bit before, you can go forward and backward on this pen and no insulin is going to come out. So once we have it to 2, what we do is we put the needle up in the air, tap on the side to make sure that there aren't any air bubbles in there, and then push the button and see if some insulin comes out. And now none came out, and that's pretty common the first time you use a pen. And so we're going to dial up to 2 again and put it in the air, tap the side, and then push it again. And we still didn't see any insulin. So what we're going to do is we're going to dial it up one more time to 2 units, put it in the air, and inject. And a lot of insulin came out that time. So we're actually ready for our dose. When you use it after this first time, you should see the insulin coming out the first time you do the priming dose. If it hadn't come out this time, we should change the needle to make sure that there isn't something wrong with the needle. And then if that still doesn't work, we should get a new pen. But ours is all ready for our first dose. What we do to start out with is choose a site that we're going to inject into. Where we inject is in the abdomen, the thigh, or the back of the upper arm. And so what I'm going to use today is a fake skin box. And so we take our alcohol swab and we wipe down the area that we're going to inject. And then we dial up to whatever dose your doctor prescribed for you. So for this demonstration, I'm going to dial up to 6 units. And there it's all ready for me. And then we find the site that we decided that we were going to inject into. We're going to put this needle straight down into the skin, press the button, hold and wait for 10 seconds, and then pull it straight out. So in, press down, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then take it straight out. When you're injecting, you can use either your thumb or you can use your pointer finger, whichever one is more comfortable for you. You might see a little drop of blood on your skin, which is normal, and don't rub or press on the site after you're done injecting. Once you've taken the needle out, you take this outer cap that we talked about before, put it on the pen, go in the opposite direction, and twist, twist, twist until you can pull it straight off. And then this goes in the sharps container, and you want to call your waste disposal company to see what their policy on sharps disposal is. And then we can put this pen cap back on the pen, and then this one can be stored in a cool, dry place because we've started using it, but all unused insulin pens should be stored in a refrigerator. If you have any other questions, talk to your pharmacist or doctor. Thanks for watching.